Good morning. Welcome back to the OHSU Effect. Summertime is almost here, which means vacation for a lot of people. And when prepping for a trip overseas, we get our passports, our airline tickets, hotels, all that. But we don't often think about vaccinations, which is even more important if you're traveling with children. With me now on the OHSU Effect is Dr. Tseng, Assistant Professor of Family Medicine. Good morning.
Good morning. How are you?
I'm good. Thank you. Thank you for being here. So what is travel medicine? What does that mean?
So it's actually a relatively new term. It pretty much is a field of medicine that encompasses preventing and treating medical issues that have to do with travel and travel internationally specifically. It can also kind of encompass medical issues related to high altitude, scuba diving, activities like that one might encounter while they're traveling abroad.
Okay, so what countries should we be more, wary of that will need vaccinations or something like that?
So that's a great question. I think you'll probably get different answers from different people. But generally what I tend to tell patients is that if you're traveling anywhere outside the first world, so if it's a second or a third world country, then you probably do want to see your travel medicine provider or a travel medicine provider about some getting vaccinations and talking about destination-related health risks.
And would the vaccination depend on what country you're going to?
Absolutely. Yes, it would.
What are some risks for travelers?
So there are a lot. I think we focus a lot on vaccinations and we focus on malaria and preventing malaria if you go somewhere where that might be an issue. But actually the number one problem people encounter while they're abroad are safety-related concerns. So you might be going to a country in which they don't drive very well or they don't drive at the standards you might be used to in the States. And so actually accidents are probably the number one concern that people encounter or issue that people encounter while they're traveling abroad.
Yeah. What is your advice if that should happen, if you do get in a car wreck or, I don't know, you fall down some stairs and break your ankle? I mean, what should people do?
Yeah. So one thing I think a lot of people don't think about is getting some sort of travel insurance before they leave for their trip. And even if you're going on a trip that's a week or 10 days, it's not a bad idea to put a little bit of money into some insurance. And so this plan would cover you in terms of if it was a serious injury, maybe you could be evacuated out of the country and come back to the States for more treatment, or it can allow you to get some treatment locally in country while you're away.
And maybe if we have children and if we're traveling with children, that might be even more important, right?
Yeah, definitely. I would say so.
So a lot of your work is vaccination related, correct? How do you know if a person is up to date on their shots?
That can be really challenging, especially for adults. For children, it's easy, which is nice. Oregon now has an immunization registry, so it does go back. If you are, I think, as old as in your mid-20s, we do have a state registry. So if you've always been in the state of Oregon, we could actually look you up on the registry, which is nice. But if we don't have that benefit or you're older than 25, say, or you've just been in a different state, then often we won't know if you've been vaccinated unless we do certain blood tests to check to see if you're immune to some of the things that we would vaccinate against.
What are some of the vaccinations that a person might need when traveling?
So specific to travel, usually hepatitis A and B are pretty common, but again, those are destination specific and depending on where you're going to go. But those are probably two of the more common ones that people encounter. Typhoid vaccine is probably another one that we find in our clinic that we give a lot. So that's one that happens for a lot of destinations that are second and third worlds. And there's some other ones that are a little bit more that are I wouldn't say uncommon, but a little less usual, like yellow fever, Japanese encephalitis. But like we said earlier, it all really depends on where you're going to go and what you're going to do.
But this takes planning, right? Vaccinations aren't always just one shot and you're done, right?
Yeah, absolutely. So usually I like to tell patients at least 4 to 6 weeks before you travel, you should definitely make an appointment for a travel consultation, whoever you see. Some vaccines you really need to have 2 of. You need 2 boosters before you're really protected before you go. So definitely a little bit of planning is beneficial.
Does the length of your trip depend on what kind of vaccinations you should get, or does that matter?
It does in some cases, and it doesn't in others. There's some that some of the more unusual ones really depend on where you're going to go and how long you're going to be there. But some of the more common ones we talked about earlier, like hepatitis A and B, those are pretty much standard no matter how long your trip is going to be.
And you can obviously help people with this information, but I believe the State Department has all these warnings and vaccinations for people as well, right?
Yeah, absolutely. So there are a couple of great websites that people can go to that are open to the public. So www.cdc.gov is a really common one. And you can look up your country that you're going to on there, and they will give you some recommendations in terms of what vaccinations you might need. And that's some good information, I think, for patients to have before they actually go to their travel visits. And just like you said, the state departments of health sometimes have that posted on their website.
Let's talk about the scuba and the high altitude that you mentioned earlier. What does that involve?
So that's a great question. So the high altitude is mainly, related to does the traveler need some sort of protection against high altitude sickness before they go, and that's going to be dependent on what they're climbing and how tall this mountain might be. They're actually specialists, people that specialize in wilderness medicine, which is I like to think of it as a related field that know probably more about that than I would, but it's certainly a lot of these destinations that people travel to do involve altitude and it may involve you wanting to do a scuba adventure. So, taking that into consideration is important for our visits.
Sure. What do you warn travelers against when they're abroad?
I think going back to the accident prevention, I think, when people go to these visits, and I'm included in this, when you go into the visits, you're very focused on whether or not you need medications for malaria or what vaccinations you need, but just realizing that there are safety concerns out there too, and just making smart decisions about when you get into taxis or taxi-like vehicles that might not be driving in the way that you're used to, and just kind of reducing your risks in terms of those types of situations is important.
Is food safety an issue that you talk to people about as well?
Absolutely. Food and water too, and just where it might be safe. Where it might be safe to maybe just use the tap, or whether or not you should really drink bottled, and thinking about some of those food concerns, like we don't think about being able to get sick maybe necessarily from a salad, but in certain countries, if you eat a salad that isn't really washed or handled properly, you can get sick from that as well.
Any other preventative measures that you tell people?
So good bug spray, I think, is another one, because there are lots of vaccinations out there, but there are also lots of tropical-related diseases and other things you can get from mosquitoes that we don't necessarily have vaccinations for. So investing in a really good DEET repellent or a bug spray is another thing that I like to talk about.
And I would say that especially if you're going to be traveling for a long time, you would need to think about your supply of medications that you maybe take at home, right?
Yeah, that's a great point. I think especially if you are taking a long trip and you might have, let's say you have diabetes or you have high blood pressure and you have to take something every day, then planning ahead for that and knowing how much you need is an important part of your travel too.
Let's talk more about if travelers need medical attention while they're abroad. Any advice that you give them? I mean, you mentioned the travel insurance, but let's say they did not get that. What should they do?
So what I like to tell patients that come through our clinic is that we are available to them by email. So, just about anywhere in the world has email and internet access now, which is just, I think, so amazing. So while we can't provide the kind of urgent attention that you might be able to get while you're here, we could at least give you the advice of, do you need to see a physician where you are right away, or can you wait a day or two? And I think that's one piece that we can do from home. What you can do while you're away, there's some really good international staffed clinics. The group I can think of that comes to mind it's called SOS International, and they have clinics all around the world. They're usually staffed by English-speaking physicians. Some of them are local to the country, and some of them are expatriates from either Europe or Australia or the United States. And I think for travelers that are from the United States, it's another good option to go to if something were to happen while you're away.
And it might be smart to look those up beforehand just in case.
Absolutely.
So you're not scrambling when you need it.
Exactly.
Well, how can someone set up an appointment to see you?
So I'm glad you asked that. So my clinic is located at Southwest 45th in Vermont. So it is through the OHSU Family Medicine at Gabriel Park Clinic. So our travel clinic is a part of that clinic, and they can call 503-494-9992. And we're happy to see anybody for a pre-travel consultation, or even if you didn't see us for the pre-travel consultation and you're sick, we also see travelers that come back and might be ill from their trips.
That's great. Dr. Ann Tseng, Assistant Professor of Family Medicine. Thank you.
Thank you so much.
This is the OHSU Effect.